Don't worry if you're in San Francisco or Orange County and still need to stock up. Major legal news from Colorado, and a new study reveals more information about cannabis and alcohol use. Today is March 19th, and this is your TRICHOMES Morning Buzz.
Broadcasting live from the TRICHOMES.com studios in Southern California. It's time for your Morning Buzz. We bring you late-breaking news that keeps you up to date with what's happening in the cannabis industry.
First up today, San Francisco and Orange County allow cannabis shops as essential businesses to stay open during shelter-in-place orders. According to NBC News, San Francisco announced late Tuesday that cannabis dispensaries may stay open during the city's shelter-in-place order, reversing an earlier decision that drew complaints from stores and their customers. Cannabis is an essential medicine for many San Francisco residents, the San Francisco Department of Public Health said in a tweet. Dispensaries can continue to operate as essential businesses during this time while practicing social distancing and other public health recommendations. After news coming late Tuesday night in Orange County that all non-essential businesses will be required to close, a reminder from local dispensary owners say they will too remain open, but with certain precautions taking place, such as limiting the number of customers allowed inside at a time and offering curbside pickup to limit contact. Similarly, New York has also deemed medical cannabis shops as essential businesses, and they will continue to make products available to patients.
Next, Colorado has declared drug possession no longer a felony. Colorado Governor Jared Polis has signed HB 19-1263 into law, which makes the possession of 4 grams or less of any Schedule 1 through 4 controlled substance a drug misdemeanor. There are some stipulations, however, such as any possession of GHB, 4 or more time offenders of possession of Schedule 1 and 2 substances, or 4 more charges for any amount of Schedule 3, 4, or 5 substances will be given a Level 4 drug felony. The new bill also puts cannabis guidelines in place. Possession of over 6 ounces of flower or 3 ounces of concentrate is to be classified as a Level 1 drug misdemeanor. Possession of 3 ounces or less of concentrates is a Level 2 drug misdemeanor. A petty offense of no more than 2 ounces of cannabis, however, will not lead to arrest. Formerly, possession of these amounts would have been a Class 4 felony. The bill also highlights a community substance use and mental health services grant program, which will provide grants to counties for the purpose of building strategies like mental health treatment services, diversion programs, and substance use services to reduce the number of people in county jails. Along with these positive outcomes, the Joint Budget Committee released a report claiming that savings from the enactment of this bill could be anywhere from $8.6 million to $13.7 million over the next 5 years, the Denver Post reports.
In political news, the Florida State Senate kills a provision to limit THC cap for younger medical cannabis patients. The Florida Senate halted a provision that would have limited THC in medical cannabis to 10% for patients younger than 21. A number of states recently moved to restrict THC, but so far the measures have failed. Despite the failure of these measures, the pushback concerns industry insiders as businesses would be required to make potentially costly adjustments to cultivation and processing methods. Cannabis businesses also complain that there's no scientific basis for arbitrary THC caps and that patients with some medical conditions benefit from high THC products. Initially, Florida's Speaker of the State House wanted to cap THC in all medical cannabis at 10%. The Florida House voted to include the cap for patients younger than 21 in a broader healthcare package, but the Senate stripped out the provision before acting on the bill late Friday.
Finally, for today, a recent study shows that legal cannabis means less drinking in younger adults. Rigorous evidence on the relationship between cannabis use and drinking comes from a study reported in the March 2020 issue of the journal Addictive Behaviors. Based on nationwide survey data covering a 10-year period, Zoe Alley and 2 other researchers at Oregon State University found that college students in U.S. states where cannabis has been legalized for recreational use were less likely to report binge drinking than college students in other states after taking into account pre-existing trends and several potential confounding variables. The difference was statistically significant among students 21 years or older, the cutoff for legally purchasing cannabis products. The apparent substitution effect, the authors note, is consistent with earlier studies that found reductions in alcohol consumption, especially binge drinking in young adults, and alcohol-related traffic accidents following the legalization of medical cannabis. More on the results of this study can be found at trichomes.com.
And that was today's Morning Buzz. Come see what the industry professionals are saying and join the conversation with the cannabis community at TRICHOMES.com. And be sure to follow TRICHOMES on all social media platforms. My name is David Fortin.
And my name is Allison Ben-Yehuda. Take care.